Welcome back to Medical Mondays with Dr. Bess. I'm here at Appleton Area Health Services. Thanks for having me back.
Thank you. Good to see you again.
It's good to see you. So we're going to be chatting today about West Nile virus.
West Nile.
Where should we start? How common is West Nile virus?
Well, it's a good time. Well, it's actually South Dakota and western Minnesota, especially northeastern South Dakota, is one of the hot spots for West Nile virus.
Really?
And we have actually the highest, or at least the second highest, if not the highest, per capita rate in the country. Now, per capita is because, South Dakota especially, we don't have very many people, so that skews that number, but still there's a significant number of cases. And so we think of that as maybe being more in the south or wherever where there's more mosquitoes, but actually up here, for reasons that aren't really clear, at least to me, we have a fair number of cases. So it's worth talking about. And the thing that always gets brought into the discussion is the mosquito, because it's transmitted by mosquitoes. And so you can't talk about West Nile without talking about mosquitoes.
Right.
And so the disease itself can run the gamut from no symptoms at all to kind of a flu-like illness to people who get extremely ill and develop problems with the brain and with their neurologic symptoms and even death.
Wow.
Yes. So it has this whole range. Now, the question is, of course, how do people have it and never find out about it? Usually they find out later on because they have a test, for example, when they go to give blood. And they'll screen that and say, well, you're positive for West Nile. They say, well, I don't recall ever having had it. So that's how we come up with the fact that there are some people who've had it that we really don't. That don't ever have any symptoms. But still, it can be serious and there can be deaths from it. Now, so the problem is there's no way to prevent it and there's no way to treat it once you get it. So it's kind of horrifying because, I mean, when we're up against a disease that we can't prevent, we can't treat, what's the take home? And the take home then gets to be about the mosquito. And there's actually a recent book by a guy named Timothy Weingard called The Mosquito. And he's actually a history professor somewhere out in Colorado. And he focuses on the mosquito and how it has transmitted diseases during history. And he makes the point, and I think it's a valid point, that there have been more people killed and dead of diseases transmitted by mosquitoes over history than there have been in all the wars that have ever been fought.
Wow.
And it's really rather dramatic when you stop to think about it. And of course, the number one killer is malaria. We don't spend a lot of time worrying about malaria in this part of the country, but West Nile is all part of that. Now, interestingly enough, there are over 3,000 different species of mosquitoes, but only 3 transmit disease. And so they're responsible for all of these diseases which cause all of this disability and sickness and death even. And we're talking about yellow fever, which played a big role when the Panama Canal was built. They had to conquer yellow fever in order to get that built because all the workers were getting sick and some of them were dying from yellow fever. But there's yellow fever, there's what's called dengue, there's malaria certainly, West Nile, and then a whole host of others too, but those are kind of the big ones. Now, all except malaria are viruses which are transmitted by the mosquito. Malaria is actually a parasite, and it lives in the mosquito and then gets transmitted. Now, a few facts, which are probably irrelevant but interesting nevertheless, is that only the female mosquito bites, and the way that happens, as most of us know, they get on your skin and then have a little proboscis thing that sticks you. And actually, that's a series. Those are 6 different proboscises that go down. This has been really studied. We know a lot about it. We just haven't made many inroads into the treatment. And some of those actually drill a hole, and then there's a main tube goes in and sucks your blood out, and another one injects an anticoagulant so that tube doesn't, so that blood doesn't coagulate. So it's they're highly developed in their attack, if you will. Another things I thought were interesting was that actually in our War of Independence, the mosquito is believed to have played a big role.
Really?
When Washington trapped the British General Cornwallis in Yorktown, Virginia, he trapped him against the ocean on a peninsula. And the only way he could get away was via ship. And there were no ships to get him away. And he trapped him in a swamp. And at one point, when Cornwallis's diaries then later on were looked at, he said that 2/3 of his men had become ill and could not fight. And it's believed that they all had malaria.
Mm-hmm.
So there's some evidence that the mosquito changed history, if you will.
Wow.
And the same thing in the Civil War. Malaria was rampant throughout the South in the Civil War, and only the North had quinine, which at that time had been developed as a treatment for that.
Mm-hmm.
And so because of that, a lot of the South was unable to maintain their armies and that kind of a thing. So then we get down to, so the whole big thing is what do we do about getting rid of the mosquito if that's the problem? Now that's also an interesting kind of historical fact because of a lady by the name of Rachel Carson. Mm-hmm. And in 1962 she wrote a book called Silent Spring in which she broadly condemned DDT. Well, DDT was an insecticide that had been around at that time for 30 years and had been used very, very successfully with essentially no side effects whatsoever. Mm-hmm. But she was convinced, without any scientific evidence whatsoever, by the way, that this was causing a problem. And she wrote this book, which was a real diatribe against, our world is going to be wiped out by DDT. Well, it wasn't wiped out in the previous 30 years, that's for sure. Mm-hmm. And at that point, William Ruckelshaus was a bureaucrat who had been appointed the head of the EPA. And so he said, well, we'll have hearings on this. So for 7 months, they collected data about DDT, very extensive. Mm-hmm. And the conclusion was that DDT offered no risk to man whatsoever, and that it was very necessary because it kept down disease. Ruckelshaus didn't go to the hearings. Ruckelshaus never read the report from the hearings, but for political reasons, he banned DDT. And when the U.S. banned DDT, the rest of the world followed. And guess what happened? In sub-Saharan Africa, the deaths from malaria skyrocketed into the millions and essentially wiped out much of the population of sub-Saharan Africa. So historically, that is a very interesting vignette, if you will,
sure,
into what happened there. And there's kind of some people that get off into conspiracy theories and things like that say one of the problems that they felt like Ruckelshaus, who's now deceased, of course, might have considered was that if we did not ban DDT, we were at risk for the population of sub-Saharan Africa exploding. And that we had no way in this world of feeding all those people. And they thought that might have been in the back of his mind because it was so obvious to everyone except him that was the wrong decision. So it really changed the course of history. So now what's interesting is we have CRISPR technology. I've written some about that in some of my columns. That's a gene-altering technology, which is relatively simple to use. Relatively, not for you and me, but for the people that do that kind of thing. And now they're looking at CRISPR technology for altering the DNA of mosquitoes. Well, how do you do that? You alter actually the DNA involved in procreation so that they then breed future generations of mosquitoes that are unable to carry disease. Now there's an interesting thought.
Right, yeah.
Yeah, so what would happen, what would be the worldwide effects? It's just almost unimaginable because disease carried by mosquitoes, it's very democratic. It's not just the US, it's not just Africa, it's everything in between. It's been seen as far as the Arctic Circle. Mm-hmm. So we think, well, these are tropical things. They're really not. Mm-hmm. So West Nile is there. We don't have a treatment, we don't have a prevention, but it gets us to thinking, what we should do. Mosquitoes generally are attracted to people with blood type O. They're attracted to people who are heavy breathers, so they exhale a lot of carbon dioxide. They're attracted to people that wear heavy fragrances. They're attracted to people that drink beer. So,
interesting.
and the one thing we have that's very effective is DEET, D-E-E-T. And the heaviest concentration we have is, I think, about 95% in deep woods off. So I don't own any stock in off or anything like that, but there's, I will put in a plug for off. If you're going to go outside at a time, and it's usually around sundown when they're the worst, why protect yourself with deep woods off if you can. And don't drink beer, don't wear perfume, and don't breathe heavy.
Wow. And before we close out today, you had mentioned that we are entering into a few months period where we do see the most diagnoses of West Nile virus.
We do.
How many, for instance, do you typically see at a place like Appleton Area Health Services, or is it sometimes none at all?
None at all.
Okay.
But on the other hand, one of the things we have to do as physicians is we have to have this fund of knowledge. We always have to be, I say, suspicious, you know.
Sure.
So when we look at something, and that's why people say, well, computers can take over medicine because they can have all this list better than you can. It hasn't worked out that way because you have to look at the whole clinical picture and then integrate that. So it's just something that we need to keep in mind and keep thinking about. And then the cynic always challenges me on that and says, well, why? We don't have any treatment. Because yes, I do. Well, the treatment is supportive for people that get very, very ill, and sometimes we can give them enough time to pull through that on their own. So we do want to do that.
Well, thank you so much, Dr. Bess. Appreciate your time.
Yes,
fascinating as always.
Yeah.
This has been Medical Mondays at Appleton Area Health Services. I'm Brendan Stromer. Thanks so much for joining us.